I had a heart attack 9 years ago. I have peripheral artery disease also. My cardiologist stopped doing the stress test every year unless I have symptoms. Yeah. I am taking Repatha. I am taking Xarelto. I am taking Plavix. I'm walking 15,000 steps a day. I'm eating more plants.
Right.
So I'm doing all these things, but I'm still nervous because I did have this sudden heart attack, and I actually heart stopped, and they had to give me CPR. There was an ER next to me, so I'm very blessed. Is there anything else I should be doing? I mean, should I have a stress? Yeah. He's saying the stress test, the chemicals they use in the stress test. So this is what stress test.
So it's not so much. So your cardiologist is not wrong. We don't do routine stress tests anymore. There are some folks out there who unfortunately still do regular stress tests, but really it's just to make money. Honestly, you know how many patients I've had that have had a stress test and then they have a heart attack a couple weeks later. The stress test completely missed it. Stress tests are a useful tool, okay? But they are not the end all be all. They will miss a lot of patients. Because it doesn't actually show you the actual blockage. It gives you a suggestion of reduction of flow. You can have a patient that's got all three arteries blocked up and they have a completely normal stress test. So these are things that are missed. And a lot of patients who can't walk and you end up doing a chemical stress test, even in that scenario, it's even worse in terms of being able to truly identify patients that are at risk. There's also a bunch of false positives as well, too, or we see stuff, turns out it was like an artifact. So there are types of stress tests that are better than others, but at the end of the day, the ability of the stress test to potentially help you identify a blockage is much better when a person actually has some symptoms where they're starting to notice something. So prophylactic stress tests doesn't really seem to help. What you're doing is way more important. You're essentially doing a mini stress test by walking those 15,000 steps. Now, if one day you go out there and you say, hey, I can't do my normal walking regimen, something's causing my energy to poop out, I'm not able to go as far as I'm normally able to, that is way more telling to me than any stress test that we could do.
Yeah.
Okay.
100%.
Yeah, yes, they missed 2 blockages I had 2 years in a row with stress tests.
Right, exactly.
Yeah.
And those blockages were brewing there, but then you had the heart attack. So that's why, I mean, there are other tests like cardiac CTA, which are better at actually identifying blockages. However, even then, then we sometimes identify blockages that don't actually cause problems or don't have any symptoms associated with it. So it's very complicated. We don't have the perfect secret sauce yet to prophylactically identify patients that are at risk. We're trying to figure it out. And this is something that's being studied right now. And, in the next 5 years, I may have a different answer for you. But in this current day, what you're doing with your walking program and your exercise and all those things, I think matter way more than going out and getting a bunch of tests. Because with all those tests, there's radiation associated with it. So you're exposing yourself to a lot of radiation, unnecessary exposure. And, people who over their lifetime get all this radiation, there is a slight increased risk of cancer. So we don't want to do these things unless we really need to.
Okay. And I do take Repatha and
which is great. Yeah.
Combination drug. They also put me on Zetia. I can't pronounce it. It's easy.
Ezetimibe. Yeah.
So they're doing that and looking into something new. So I'm with MUSC in Charleston. My cardiologist.
I know those guys are good. They're quite good.
Yeah, they're good. I go and because I have a defibrillator too, so I have a little bit of everything. But I'm glad to hear your answer that we're doing the right thing.
Yeah. And the MUSC folks, I mean, they're academic cardiologists and they're doing the right thing. You'll see that sometimes out in the community, there's a lot of people who believe in doing routine tests all the time. And unfortunately, like I said, it's not going to give you the information that you necessarily want. Sometimes it can, but a lot of times you end up getting a test and it's normal. And can you hang your hat on that normal test? And sometimes we can't.
Okay. And I think, Dr. Mathews, you brought up this one point that's a great point over and over again, which is it's more telling if you as the doctor is asking the right questions, right? You're asking, what are the symptoms? What are you experiencing? Are you slowing down? That kind of thing. That was the difference for my dad was he went to one doctor. He had the 256 slice CT scan and he had 8% growth in his LAD and in his right coronary. And his LAD was over 80%, and his right coronary was 97%. And the doctor's like, so how do you feel? My dad's like, oh, I feel great. He's like, okay, then we're not going to do anything. I'll see you in 6 months. He goes to his VA doctor, who says, hey, Bill, how's that walking? How are you walking, this week versus, a month ago? And he's like, oh, I kind of slowed down a little bit, but I'm still feeling good. It's like, well, how much have you slowed down? Why have you slowed down?
Right.
Little shortness of breath, things like that. And he's like, you're pretty close to a heart attack here, a major event. And he went in and opened it up.
A lot of people will self-regulate, auto-regulate. They'll start limiting themselves in terms of their activity. A lot of folks, they don't think anything of it. They're like, maybe it happens over time, so they don't really notice it. They're like, oh, I'm kind of too lazy to go exercise now. But sometimes it's because they can't exercise. Yeah. And so I think that's really important. Again, asking the right questions and also being honest with yourself too. Are you slowing down? Are you not able to do the things that you're able to do for a reason? And that's our job to figure out, is there something medical that's causing that problem?